In the United States, if you get sick, you don't want to go to the emergency room right away. And I learned that lesson the hard way. So, Nurse Rebecca, if I cannot go to the ED, where should I go? In today's episode of Pinoy Nurse Portal, we will talk about all the confusing terms in the healthcare system in the United States. We will talk about premium, deductible, copay, PCP or primary care provider, urgent care, when to go to ED, when to go to the urgent care, and have you heard of the term out-of-pocket maximum? All this and more in today's episode of Pinoy Nurse Portal. Hello, this is your nurse Rebecca, and if you are interested, please stick around. All right, let's start today's vlog by defining some terms. Let's start with the word premium. So what is premium? A premium basically is the amount of money you need to pay to an insurance company to get an insurance coverage, okay? So if you are employed, a portion of that premium will also be paid by the employer. But if you are self-employed, you get to pay the whole amount of that premium every month or every 2 weeks. I am currently employed and we are paid bi-weekly. So every 2 weeks, I have to pay a portion of that premium to pay for my medical insurance, my dental insurance, and my eye insurance. And if you have a pet, you can also get a pet, I think it's called pet care insurance or something like that. And yes, a portion of that is also paid by the employer if they offer that in your employment. Okay? Next, let's talk about deductible. So what is a deductible? For example, you got sick, or let's say, for example, you gave birth. So you are admitted at the hospital and your final bill, let's say, is $55,000. Do I have to pay the whole $55,000? Well, if you don't have an insurance, then yes. But if you do have an insurance and you are paying your premium every month, you only get to pay the deductible. And how much will that be, Nurse Rebecca? The answer is it depends on the type of the insurance you are paying for. Like for example, my current deductible right now is $2,000. So out of that $55,000 bill that I have at the hospital, I will only pay the $2,000 deductible. Maliwanag ba? Next, let's talk about the difference between the premium and a deductible. A premium is something you have to pay regardless if you are using your health insurance or not, whether you got sick or not. If you want to maintain your insurance coverage, you have to pay that on a monthly basis. Whereas a deductible, you only pay for that if you are admitted or if you get sick. Clear? Next, let's talk about out-of-pocket maximum. And what is that, Nurse Rebecca? Out-of-pocket maximum is the maximum amount of money you have to pay your insurance before they pay the rest of your hospital bill. Okay, so let me give you an example. Let's say in January you gave birth and your deductible, let's say, is $2,000 and you already paid for that. Let's say you have another family member who needs to go to the hospital and was admitted. Okay, and let's say your out-of-pocket maximum is $5,000. Now again, it will vary depending on the type of insurance you will purchase. But let's say your out-of-pocket maximum is $5,000. So you already paid $2,000 when you gave birth. So now your husband needs to go to the hospital and he was admitted. And you need to pay another $2,000 for the entirety of his hospital bill. Now, the following month, he needs to go back for, let's say, a rehab, okay? And the copay or the deductible for that is another $2,000. So, you giving birth, when he went to the hospital the first time, and when he needed to go to the rehab, that's a total of $6,000 if your deductible is $2,000. So 222, that's $6,000. But your out-of-pocket maximum based on your insurance is $5,000. The question is, do you have to pay the whole $6,000? The answer is no. You only get to pay up to $5,000 based on the premium you are paying, because that's what's stated in your insurance. So let's say, so January you gave birth, your husband got sick in February, in March he needs to go to rehab. Let's say sometime in August he needs to go back to the hospital for another type of illness. Do you have to pay a deductible? Again, the answer is no, because you've already reached the maximum out of pocket, which is $5,000. Did you understand? If you have more questions, please just comment down below. Okay? Next, let's talk about copay or copayment. So Nurse Rebecca, what is that? Well, copay or copayment is a fixed amount of money you pay in exchange of a medical service. Okay, this is a fixed amount. Let's say, for example, you went to see your PCP, which is a primary care provider. Don't worry, we will talk about that later on. Or you went to an urgent care. What is urgent care? Don't worry, we will also talk about that later. So every time you go see your PCP or you go to an urgent care, you only get to pay a portion of that bill. Let's say you went to urgent care for nausea, vomiting. They wrote you a prescription. So in that visit, they billed you, let's say, $250. Do you have to pay the whole $250 for that visit? The answer is no. You only pay your copay. And every time I go to an urgent care, in my current insurance right now, my copay is $30. But the copay is not only limited to medical services, okay? When you go to your dentist and you go see your optometrist, you also have a copay every time you see them. So you don't get to pay the whole bill every time you see your optometrist and your dentist. You will only pay a portion of that, which is called the copay. You understand? Okay. Next, let's talk about the difference between urgent care and a PCP or primary care provider. Now, this is a tip for new immigrants out there. If you're watching this, once you are settled and you have an existing medical condition, let's say you have hypertension, hyperlipidemia, or diabetes, please look for a primary care provider immediately as soon as you arrive or as soon as you get your medical insurance, okay? Because you need someone to talk to or to call every time you need a prescription and all of that. You will understand this more towards the end of this vlog, okay? So let's differentiate urgent care and PCP. Urgent care is like a clinic that you can go to every time you have minor emergency. You don't go to urgent care if you have heart attack, trauma, or stroke, okay? You go to urgent care for like flu-like symptoms, nausea, vomiting, something like you sprained your leg or even fracture. They can do simple casting, or you call casting simple, in the urgent care. When my kids were little, I was a Suki at an urgent care, especially my middle child. We always go there. She always gets sick, and I don't go to the emergency room when they get sick, because like I said at the beginning of this vlog, I learned that the hard way. So 2006, my eldest, I only had one kid back then, she got sick, and I googled where is a hospital, like a good hospital for children. Well, in Arizona, that is Phoenix Children's Hospital. So we went there and we went to the emergency room for a flu-like symptoms. You know what they did to my child? They gave her Tylenol and popsicle. You know how much bill I paid? I paid a whopping $250. You know why? Because that's the copay for my insurance back then. Now, if you go to an emergency room, I think the copay now is $350. And why do I have to pay the copay of $250? Because if your child is not admitted for that illness that she went to the emergency room for, you have to pay the copay. But let's say your child was admitted in a regular floor after going to the emergency room, but she was not there for over 24 hours, you still have to pay your copay because that's not considered an inpatient admission. That is an observation, okay? So your child has to be admitted over 24 hours in an inpatient unit for you or for them to waive the copay of $250. Okay, so let's say your child was admitted in a regular floor. Okay, so and she stayed there for 3 days. Do you still have to pay the copay or the deductible? Do you know the answer? Comment down below. If you're listening to this vlog, then you know the answer. The answer is you have to pay the deductible. And it depends on the type of insurance that you have. You understand? Okay. All right, medyo na-segue tayo doon. Let's go back to the difference between an urgent care and a primary care provider. Urgent care, like I said, is like a clinic for minor injuries, minor illness that you can go to. And take note, they are not open 24/7. They are open office hours, so it's 9 to 5, okay? But some urgent care, especially for kids, they have a good night urgent care, which we love when my kids were little and we were there all the time. They are open from 5 p.m. to 5 a.m., which is really, really convenient, okay? So urgent care, you can walk in anytime as long as they are open. PCP or primary care provider, or the doctor or the provider you chose for yourself or your family, you cannot walk in anytime. You can call them to refill a prescription, but you cannot go there anytime you want, okay? You need to make an appointment to see your primary care provider. And how do you choose a primary care provider? It depends on your insurance, okay? So let's say my friend suggested a good primary care doctor, a good nurse practitioner, or a good doctor. Can I just go there? The answer is it depends on the insurance. Your insurance will have a group of doctors you can go to. So it's very, very limited. But can you still go to that doctor that your friend suggested? The answer is yes, but you have to pay a little more, okay? And your insurance might not even cover for that visit, okay? So urgent care, you can walk in. Primary care provider, you have to call them to make an appointment. Another tip I can give for future immigrants or new immigrants in the United States, so if you already chose or found a good PCP or a PCP that's covered within that insurance that you have and you need to see them, please call them immediately, okay? As soon as you have your insurance coverage. You know why? The first time you see the PCP, it will take a month, even 2 months before you could see them, and I am not joking. So if you have an asthmatic child, or if you get sick all the time, or if you have, like I said, a pre-existing condition like diabetes, you need prescription all the time for whatever illness you have, choose a primary care provider as soon as you get here and call them immediately as soon as you get your medical insurance, because it takes a long time to see them for first-time clients, okay? But the next time you see them, it's still not a day or 2 days. It takes weeks before you see them on your second visit. That's why it's important to know that you can go to an urgent care if you need something. Let's say, for example, you just arrived in the United States and you found a PCP and you need prescription for your hypertension, and your appointment is in 2 months, but you run out of your prescription. What can you do? You can go to the urgent care. In the meantime that you are waiting for your PCP appointment, the urgent care can write your prescription for your hypertension while you are waiting to see your PCP, okay? Another thing to note is when you get prescription, there is such a thing as refill, okay? So when you look at your prescription, it will give you refill times 2. What it means is, for example, you need hypertension medication and your prescription is only for 30 days. You can ask your PCP, that way he doesn't have to see you all the time, to write you a refill. Tell your doctor, doctor, can you please write a refill for 6 months or something like that. And it actually depends on the type of illness you are seeing. There are type of medical condition that you need to see your PCP every month. But once again, take note that the first time you need to see a PCP is so hard to get a hold of them or to see them. All right, so good luck to you. I mean, I don't mean that the wrong way, so good luck. All right, so let's say you went to the urgent care, or you were admitted in the hospital, or you went to see your dentist and you had an oral surgery and you are given a prescription. Okay, one of the biggest culture shocks I had when I first came to the United States is about prescription. In the Philippines, if you get sick and if you are given prescription, you go to Mercury Drug, present your prescription written, okay, and they will fill your prescription right there and then. Okay, in the United States, that's not how it works. So how does it work, Nurse Rebecca? Well, we will talk about that on our next vlog. We will have a part 2 because I'm paos already. Okay, so for now, let me say thank you so much for watching today's episode of Pinoy Nurse Portal. If you learned something, please like, share, and comment down below, okay? And if you're not a subscriber yet, please don't forget to subscribe to this channel. And I have my social media accounts, which will be linked in the description down below. Thank you so much for watching. See you on our next vlog. I promise I will film that today. Basta, I just have to rest my vocal cords. See you!